The Risk Stratification Tool. In the central London borough of Kensington and Chelsea, the local primary care trust worked in collaboration with two existing exercise referral schemes and the local authority to develop local exercise opportunities and develop the Irwin Morgan traffic light system. They used the National Quality Assurance Framework as the basis of development process and also looked at examples of several different schemes across the UK. These schemes largely took a risk stratification approach, defining health conditions as high, medium, and low risk. While the group thought this provided a clear and easy way to consider risk, none of the examples contained sufficient detail for the referring clinician to be able to categorize patients. For example, minor bone density changes represent low risk, but a diagnosis of osteoporosis with no history of fracture increases the risk to medium. When a history of previous low trauma fracture is factored into the equation, this represents a high risk. Therefore, the patient is not suitable for the scheme, but for specialist referral into the Falls and Injury Prevention Exercise Service. The 6th edition of the American College of Sports Medicine Guidelines for Exercise Testing and Prescription was used as a resource for evidence along with ACSM position stands on osteoporosis, type 2 diabetes, hypertension, and older adults. Other sources of guidelines included the Chartered Society of Physiotherapy Guidelines for the Management of Osteoporosis and the British Association of Cardiac Rehabilitation. Using the tool. The tool takes the form of a simple traffic light system and is produced as a laminated A4 card. Basic information about the various schemes is printed on the reverse side, and each scheme has also received a color coding which corresponds to the risk level that it can take. Finally, Irwin and Morgan have redesigned the referral forms so that clinicians can indicate the tick level of the condition for which they are referring. Green light, low risk, people with minor, stable physical limitations or 2 or less CHD factors. The risk tool looks at topics such as overweight, high normal blood pressure, type 2 diabetes, reconditioned, older people aged over 65, antenatal, postnatal, osteoarthritis, mild bone density changes, exercise-induced asthma, smokers, stress or mild anxiety, seropositive HIV. Amber light. Medium risk, people with significant physical limitations related to chronic disease or disability. The risk tool looks at topics such as hypertension, stage 1, type 2 diabetes, type 1 diabetes, physical disabilities, moderate rheumatoid arthritis and osteoarthritis, clinical diagnosis osteoporosis, surgery, pre and post, intermittent claudication, stroke or TIA, asthma, chronic obstruction pulmonary disease, neurological conditions, early symptomatic HIV, chronic fatigue syndrome, depression, or fibromyalgia. Red light. High risk. People with current severe disease or disability, not suitable for exercise referral schemes. Older people ages over 65 years at risk of falls. Frail older people with osteoporosis and history of fracture. Unstable and uncontrollable cardiac disease. Claudication with cardiac dysfunction, orthostatic hypotension, stroke or TIA, transient Asiatic attack, severe rheumatoid arthritis and osteoarthritis. Conclusion. Irwin and Morgan expect that the risk stratification tool will help increase the confidence of clinicians to refer their patients to exercise referral schemes. Also, an evidence-based risk stratification tool is likely to make referrals safer and more effective.